This video has been made for healthcare professionals in the mental health setting. In particular, we'll be looking at blood pressure and heart rate monitoring and why it's very important to keep monitoring these vital signs.
Let's start off by familiarising ourselves to the National Early Warning Score 2, NEWS2. This is a specific tool designed by the Royal College of Physicians to help identify those patients who are acutely unwell. For example, those with sepsis. NEWS2 covers 6 physiological parameters. These include respiratory rate, oxygen saturations, heart rate, blood pressure, level of consciousness or alertness, and body temperature. These parameters constitute the basis of the scoring system. Hopefully you should be familiar with this system as used in daily practice in an inpatient setting. Pause the video to review this table. This simply describes the various clinical responses to NEWS2 trigger thresholds.
Let's briefly go back to basics. The heart is a vital organ mainly made of muscle. The right side of the heart pumps blood to the lungs to receive oxygen and to get rid of waste products, whereas the left side of the heart pumps oxygen-rich blood to the rest of the body. By pumping blood around the whole body, it enables all our organs and tissues to survive. Without oxygen and nutrients in our blood, our organs begin to shut down and fail, which can then be fatal. Heart rate is the number of times the heart is beating in 1 minute. Normal heart rate falls between 60 to 100 beats per minute. Blood pressure is simply the measure of the force needed to push blood around the body. Blood pressure is represented as 2 figures: systolic, the value on top; diastolic, the value on the bottom. Systolic blood pressure represents the pressure of when your heart pushes blood out. Diastolic blood pressure is the pressure of when your heart rests between the beats. High blood pressure is often related to unhealthy lifestyle habits, such as being overweight, smoking, drinking too much alcohol, and lack of exercise. If you consistently have high blood pressure, then this increases your risk of developing kidney disease and coronary heart disease, whereas low blood pressure is associated with underlying conditions such as clinical dehydration or heart failure. It can also be associated with side effects to certain medications such as amlodipine and ramipril. There are many factors that can temporarily affect your heart rate and blood pressure. For instance, examples of when your heart rate and blood pressure goes up: 1. Vigorous exercise; 2. Heightened emotional state; and 3. Fight and flight response. And examples of your heart rate and blood pressure going down include 1. Sleeping; 2. Meditation; 3. Certain medications such as sedatives. If you are in a situation where you find your patient presenting with worrying vital signs, then 1. Review the patient. Do they look unwell? Are they in distress? 2. See if there's any obvious triggers. 3. Escalate the readings to your senior and/or call for help. 4. Repeat the vital signs after 5 to 10 minutes. Abnormal vital signs can indicate underlying cardiovascular disease, CVD. That means disease affecting the heart and blood vessels. This includes angina, myocardial infarction or heart attack, hypertension, stroke, and vascular dementia. Risk factors for CVD include high cholesterol, high blood pressure, diabetes, obesity, smoking, and lack of physical activity. According to NHS England, CVD affects around 7 million people in the UK and is a significant cause of disability and death. In fact, CVD is responsible for 1 in 4 premature deaths in the UK. A patient with severe mental illness have 53% higher risk of CVD and 85% higher risk of death from CVD. With this in mind, we as healthcare professionals should be more alert and attentive when it comes to monitoring vital signs, as we could potentially pick up signs of CVD. We are now going to watch an acute scenario based in an older adult inpatient unit. This is Mr. X, a fictional patient. Pause the video. Discuss what you should do next. Check for hazards and then check if the patient is responsive.
Mr. X, is everything okay?
Oh, I've got chest pain. Oh my god. Call for help.
The patient is responsive but in a lot of distress, and it would be necessary to call for immediate help before checking airway, breathing, circulation and the rest of the vital signs.
Whilst waiting for the duty doctor, here's some proactive tips. 1. Do a 12-lead ECG. 2. Repeat vital signs. 3. Do a head-to-toe survey. 4. Look at previous vital signs. Look at a food chart, drug chart, fluid chart and bowel chart for any possible triggers.
Eli, could you please get the emergency grab bag and medication tray?
Yes, doctor.
Oh no, ST elevation. Mr. X is having a heart attack. Call 999.
I'm on it, Doc. Remember the acronyms that are ABC. D for danger, R for response, A for airways, B for breathing, and C for circulation.
If the news score is greater than 4, escalate and call for help immediately.
Always call for help if you're worried about a patient, or if you have any queries, speak to an on-duty doctor or the nurse in charge.